Breast augmentation. I always talk with patients that there's four main things to know in breast augmentation. Patient like this comes in, she's a perfect candidate, she's got nice natural breasts, but she wants them fuller. So how do we make decisions? Well, we want to make decisions on the incision, the implant position, the type of implant, and the size of the implant. So to go through that with a patient, basically we start talking about the incision. So there's two main incisions that are good in breast augmentation. Those are going to be inframammary or underneath the breast, or perioreolar at the bottom edge of the areola. Both are good, both result in nice scars. The vast majority of my patients end up choosing an inframammary position for their incision because it's off the front of the breast. And as long as they have a nice fold, it tends to hide better there. Some patients are better for a perioreolar incision, and so that's why we look at everyone individually to make those decisions with them. The second thing we think about is the position of the implant, and that's in relation to the breast and the chest and the muscle. The implant can be in front of the muscle, but the vast majority of my patients are going to get implants behind the muscle in what's called a dual plane position. Why? Well, we're using breast implants to provide volume, to fill a breast to make it look fuller. But at the same time, we want natural, beautiful results. And so in general, I think putting an implant behind the breast, behind the muscle, hides the implant. We don't want to see the implant, we don't want to feel the implant. We want the implant down deep, doing the work of filling up space to provide volume. The third thing is the type of implant. Pretty much universally in all patients nowadays, these are the best implants on the market. These are cohesive silicone gel, it's a gummy bear implant. And this is by far the best technology. It's got the best performance. It doesn't really have rippling, looks the most natural, feels the most natural. So I tell patients this thing's going to be in for a long time, so there's no reason not to use the best device possible. And so everyone's going to get these pretty much. And then the last thing, size. So how do we make decisions on size? This is something women think a lot about and ask a lot of questions about. At the end, the size of the implant is just a number on your implant card. What the important thing is choosing the right size for someone's body to give them the shape that they want. So what I tell patients is the way we do that is when we see them, we're going to take a bunch of measurements and we're going to fill all of those in here. And then we're going to take a look at what they want. So depending on the style of breast that a patient wants, that'll determine the implant that's best for them. And what I tell patients, if you look at implants as they get bigger, they're going to get bigger this way and bigger this way, okay? So when we put an implant in, we put it in through, let's say, an inframammary incision. We dissect a pocket behind the muscle where that implant's going to live, and then we decide on implants, okay? Implants come in all types of shapes and sizes. So this is the sort of lines that we use, and you can see there's lots of options. Now, the key in decision making, again, is what the patient wants. So the way I explain it is when we put an implant in, it's going to sit in the pocket. And the bottom edge is going to sit at the fold and at the inner aspect. So we always get this part full. And then as we go up in implant size, the implant grows. So as we go up in size from, say, a 300 to a 320 to a 340 to a 370 to a 400, etc., what happens is the implant is going to come up the chest wall and out to the side. So you're going to get more superior pore fullness and more lateral fullness as the implant size grows. So if we get a patient that wants to be very natural, we can put in a smaller implant. She can get nice fullness on the bottom, but still a very natural upper pull. As we go up in the relative size of the implant on a patient, we're going to get more superior pull fullness. So the next level up may be a patient like this. She wants a very small amount of superior pull fullness, but still wants to look very natural and not overdone. Maybe a step up patient, maybe a patient like this. She wants to have more of a rounded appearance, but not to be, so heavy in the breast that it's the first thing that sticks out. So she may get an upper pull fullness, such as this. And finally, the patient that wants to be kind of as big as possible, in my practice, is wanting a result like this, where she gets a lot of superior pull fullness. It comes up the chest. She's got lateral roundness to the breast as well, but it's still looking natural. And that'll be about the top of what we do because we don't want to put in something that's going to look funny or unnatural. So this is all done individually with patients on a case-by-case basis, and those are the steps that we go through in consultation. And what I tell patients is, what I need is to fully understand what you want, understand